I always say to people I'm working with or teaching or whatever, never assume that your patients have any knowledge that you know, anything like the knowledge that you have, because I think for us, we assume, oh, that's so basic, you know, breathing, it's so basic.
Yeah.
Small changes that we think are basic can be transformational. And that's the other thing I think to take home, is that we could promote these small adjustments, life adjustments, without even seeing people, that if they implement in their lives, can make huge changes.
Exactly.
But we feel that we always have to leap to the more complicated solutions to what are sometimes very simple problems.
Yeah, exactly. And so Kate Walsh, pelvic health physio for the past 20 years, working either in NHS and in private practice. Education has been a big part of your life. You've been teaching in postgraduate and undergraduate courses. On your own words, you're the mother of 3, wife of 1, yeah. More than enough, I would say. And we met in Liverpool, so I was lucky enough to have you as my clinical lead and as the manager of our department at the Liverpool Women's Hospital. And well, thank you so much, Kate, for being here and for wanting to globalize pelvic health together. I know it's also kind of part of your mission, let's say, to advocate towards pelvic health and to talk about pelvic health as many times to as many people you can. So again, thank you very much for being here.
Thank you. Thank you for inviting me. It's such an honor and it's such a pleasure to see you, because yes. We miss you in Liverpool. I miss massively.
Okay, so you know what? I think we should start with the elephant in the room. That is, let's talk about what pelvic health is. It's such a big theme, right? And it's probably something that is difficult to define, and that so many people still kind of don't really understand what we are talking about when we talk about pelvic health, no matter in how many ways we try to define it. So what is your very own definition of pelvic health?
Well, I think this is really interesting to me, because I've had to do a few presentations recently around redeveloping a pelvic health service and a pelvic physiotherapy service. As you know, we had a lot of work to do at the Women's, trying to bring the department up to where we are as a speciality. And in the time I've been working, which is now over 20 years, I feel like such a dinosaur, I've seen such a huge change. And the challenge is keeping up with the change in how we approach it. But I've also been reading around the subject of why is pelvic health such an elusive concept? And it's elusive because there's no definition. Because if you think about it, most of the things that we manage in medicine are defined and standardized, and that's what people base their communication on, about their exchange of ideas, if you like. And that's how we generate research, and we generate interest, and we motivate practice and so on, not just to health professionals, but to our patients and the populations that we serve. But if you think about pelvic health, there is no definition. So there's nothing to base our communication on, because everything that we do is based towards dysfunction, pelvic floor dysfunction and disorder. And I think the problem is that we have to redress that balance and promote pelvic health before it becomes dysfunction, but also try and understand what we're trying to achieve with pelvic health. And I was reading, there's a really seminal article by Halen et al. In 2010. You may have read it, that standardization of terms. It's the IUGA ICF. And it came out with over 250 definitions of different pelvic floor dysfunctions. And that kind of gives you an insight into the complexity and the scope of the problem and the challenge in treating it. But when you have so many dysfunctions, how can you possibly define what pelvic health is? Does that make sense?
Yes.
So
yes.
I think if we're thinking about pelvic health as a concept, we have to think not just only anatomically, and physiologically, but also psychologically and socially. And then all those factors link in to create the person that is, you know, living within the context of their lives. And I think it's the only way you can successfully gain understanding about what, and it's different for everyone. It's different for all ages, it's different for all stages, it's different for different demographic groups. So really there's no standard definition that underpins what we do, which is what makes it A, so enjoyable, but B, so challenging, and C, so difficult to get robust research on, where we can actually measure the outcomes of what we're doing. So I think that's where I'm coming from with pelvic health. And I think if we can turn this sort of ship around and now start globally promoting pelvic health, so that both health professionals and patients understand what we're educating them on and what to look out for and how to look out when you deviate from that norm, then we'll start to make progress.
You know, what I find very interesting is that we call it pelvic health. So of course you spoke about disorders and dysfunction, and that's mainly what we see when we are working in a hospital or eventually even in a community health center. But because we call it pelvic health, I think that it's kind of a very optimistic way of putting it, because not only we are concerned about the dysfunctions and the disorders that you mentioned, but also we are concerned, or we're really caring about the function of the structures of the pelvic floor, but not only, of course. So do you think that whoever created the term pelvic health was actually thinking more about the function itself and keeping the function healthy, or is it just my romantic side?
Yeah, I know you have a very romantic side.
Yes.
I think I like the focus on pelvic health. And if you look at what we've in the UK as physios within the speciality, we've gone through so many different identities. You know, in my time, I was, to begin with, physio in obs and gynae, then physio in women's health. I've been a physio in continence services, bladder and bowel, and then physio in pelvic floor, men and women's pelvic floor services. Then we, even in our professional sort of sub-professional special interest group, the POGP, that was always called ACPU, physios in women's health, ACPOG, you know, physios in obs and gynae. So then we sort of had a nod towards the fact that men have pelvises too. So we brought in the new name, and that is, I can't remember what it is now, physios in obstetric, gynecology and pelvic health. So I think as a profession, we've certainly steering ourselves more towards calling, I say I'm a specialist physio in pelvic health now. But the problem is, I think, it's when people don't understand what pelvic health is, they can't then understand when they deviate from that, and therefore when to go and seek help. So the health seeking behavior is very poor in pelvic health in the UK, because so many women and men don't understand what we even mean by that. So if you take an example of a perimenopausal woman who has started to get a bit leaky, you know, a little bit of urinary leakage, and they just accept it as part of being that age or part of the menopause. They don't really understand what the health dimension is. So therefore they don't understand when they come away from that. It's just accepted. And that's one of the big problems, I think, that we're battling, because how can we specialize in an area that people don't really understand what we do? And that's what happens here. You know, you've seen it firsthand. But when you talk about function, sorry, I'm being bitten to death by the dog here. She's chewing my wrist.
You should show her to the camera if she
will.
To...
She'll come up. There's no doubt. If I stop letting her chew my hand, she'll be up. Here she comes. Here she comes.
Yes. Hey, you beauty.
Blending well into my sweater. So I've lost my train of thought now. Oh yeah, so back in the day when we were more obs and gynae, more compartmentalized, we didn't really think about overlap.
Probably.
Yeah. it was one of those things where we weren't really looking at function. We were looking in a very abstract way at the symptoms and how we can, and we were looking at components of function. And now I think we're much better at looking at the bigger picture and actually looking at all the different components and how they feed into that person, and then what we can influence or what we can modify. Because the thing about our area that makes it so interesting is that the doctors will rule out all the sort of pathologies and things going on, but they still got pain, or they still can't have sex, or they still leak, or they still can't open their bowels, you know, which has such a profound impact on their life. So yeah, function is, I think, the essence of pelvic health, to function to a level that you are comfortable with, which means that you can live the life you want to live.
Yes. Well, and just to clarify, pelvic health is definitely a terminology that is linked to physiotherapy.
Oh, is it?
Well, I would say so. I mean, you don't really see, or you don't really hear gynecologists and urologists and gastroenterologists to use the terminology or the term pelvic health when they talk about what they do. Or do you actually hear them?
Here in the UK?
Yeah, in the UK.
No.
Okay.
And by the way, this isn't wine. This is Diet Coke. Not that you'd care if it was. Well, I think that, again, it's the culture, isn't it? And I've been learning a lot about culture with this course I've been doing in Liverpool at the uni. And I think the culture is embedded values and beliefs that you don't even realize are there, but they dictate so much of how we practice. And I think the medical professionals still refer to us as pelvic floor physios, which I find very frustrating. And so many of the talks I give, I do titles like more than just the pelvic floor, because they don't see it as the dynamic system it is. They don't see that it's constantly changing. They don't see all the demands that are put on it. And they don't see how often the pelvic floor is either the cause of, the consequence of, or perpetuated by the problem. So they just don't have any sort of, well, it's not that they don't. I think sometimes they just don't have the time to think about it. But some medical professionals are very open to wanting to know more about what we do, because people have said to me, you know, you're like gold dust, your profession, because we can only get our patients so far, and then we don't know what to do with them. But when they have their functional bowel problems, their functional pain, whatever, we're the ones that can help them learn how to live and rehabilitate them. And do you not think that's the basis of what physio is?
Definitely.
Rehabilitation.
Yes, rehabilitation and bringing back the function, or improving even the previous function, even if it was already good, but maybe it could be even better. So if you ask me, what I feel is that, though I really feel, I believe that pelvic health is definitely a terminology that so far has been much linked to, or much more linked to physio than to any other speciality in healthcare. But what I feel is that because it's so big and it's so inclusive, it should actually be a terminology that should be used by all of us that work with people, I would say, because pelvic health actually is linked to many other areas of healthcare. And you also have a background as an MSK physio, so musculoskeletal physiotherapy.
And well, neuro was my thing.
And neuro rehab. I do remember that. So and do you feel that background that you have has been helping you significantly in
very much so, Elizabeth, because when I first started doing this as a student, and I've been qualified 30 years this year, so I loved it, but it was very obs and gynae. It was very pregnancy, postnatal, urogynae, incontinence. It was very prescriptive. I'm sure I've told you about stories like when we did interferential and so on. We didn't even assess the patients. They were just sent to us by the gynecologist. And we didn't do internal electrodes. So we were in MSK outpatients and we just slapped the interferential on, put them on it, went and made a cup of tea and did our notes. I'm embarrassed to think I did that. And we would go around the postnatal wards and the gynae wards, and you would see people and tell them how to do pelvic floor exercises. And then I did it as a junior, and I started to think, oh, it's starting to get more interesting. But in all honesty, it was a bit limiting, because I thought, well, this isn't what I want to spend my career doing. And internal examinations were very limited. I mean, you literally went in and out, got them to do it, squeeze the pelvic floor. And I hate that word squeeze now, because I just feel that isn't descriptive of what we're trying to get people to do.
Yeah.
And it can encourage them to use other muscles. So then I specialized in neuro rehab, and that suited my brain much more, because it was the whole person. It was normal movement. It was rehabilitating, facilitating movement, inhibiting movement, abnormal movement patterns. And then when I went back to this sort of 20 odd years ago, I was a little bit wary, because I thought, oh, I wanted to get my teeth into something again. And it had already moved on. And then it was starting to bring in function. It was starting to recognize not only what goes on within the pelvis, but how it mirrors what goes on externally. And I think my training in normal movement and neuro rehab helped me understand about facilitating the normal movement patterns, trying to inhibit the abnormal compensatory movement, which we get so often with our pain patients. And we're also seeing a much bigger population of more complex, multi-compartment, multi-symptom patients. And I don't know whether these people, I think these people, it wasn't that more people are suffering. I think more people were talking about it, and more people were recognizing what we can do to help them. And they're the patients that the MSK physios are limited with, because they can't do internals. They can't do vaginal examinations. Not that they can't, they haven't been trained in it. They haven't been trained in rectal examinations. So it does limit your access, and that limits your potential to help them. So it really opened my eyes. And so, yes, in answer to your question, a lot of people have gone into pelvic health straight off from uni. I always encourage the undergrads who I teach to get a nice broad experience and really get an understanding of lots of different areas, because it's not the sort of super focused speciality that we used to think it was 20 years ago. We now realize that it's multi-system, and it's multi-dimensional. And if you understand that better if you've had exposure to other areas, whether it's MS. I mean, I did the basic MSK, I did it as a junior, but my heart was in the neuro rehab, definitely. And then, of course, lots of us do the Pilates training, and that is very instinctive, I think, to us as physios. Exactly. Do you agree?
I do agree. Yes.
And it's watching how people move.
Exactly. Yeah, and it adds so much to the concept of pelvic health, because if we think about physios working in pelvic health, is having to see the person as a whole, and not only as the pelvic floor that we still hear so many times, that designation when someone talks about pelvic health physio.
And it's interesting for me to see that suddenly other clinicians are becoming really quite interested and quite excited by what we do, whereas in the past they might have just sort of blocked it out.
Yeah.
And I think it suffers from being in such a dark and hidden an area that's so associated with such personal and private things, that people become quite anxious about being involved, and not just patients, clinicians. A lot of some of the patients that we see, and the way they talk to us, they open up, and it's a privilege, a huge privilege.
They're just waiting to be inquired about the pelvic health.
Yes. And I think it's what you do with that information that makes us unique. And I think some people aren't really ready to really receive and do anything with it that will be useful, that will help that patient's function, and are possibly a bit frightened of it.
I do agree. Do you know if patients are already able to self-refer to pelvic health physio in the UK in general, or in certain areas of the country?
Good question. Yes, privately. Anyone can walk off the street and come. So people can come to me in my private practice, which is one of the hurdles that going into the women's, where, as you remember, you were referred into the hospital and then go through this rather circuitous route of different specialist clinics. And there was a lot of sort of wariness about, oh, well, do we really, are we really able to assess and triage and refer on and have this sort of scope of practice to be able to do that? But that's just NHS bureaucracy. In private practice, 100% you can self-refer. And this is where accessibility needs to be improved in the NHS. And it's one of the things where finally we've got our direct GP access started as of today.
Okay, whoa.
Yay! So that is a big step towards making our service accessible to people who maybe haven't got the opportunity or the resources to access private care, which is a large number, especially in Liverpool. There's a big diverse group of populations, as you remember, who wouldn't be able to come and pay for private physio. So it's a real step forward that we have that, because it just gives that flexibility. And at the moment, post-COVID, everyone's lists are so long that some people are having to go privately just to get themselves seen more quickly, who may not have done before. But they're having to wait crazy lengths of time sometimes through the NHS.
Well, there's optimism there, I would say, and also very optimistic the fact that you very recently went to give a talk or a workshop, I don't know very well, to the military people was that in London?
It was in no, where was it? It was down in the Cotswolds, so just past Andover. So it was an interesting one. It was our POGP was asked to present a series of courses to the physios who are employed by the Ministry of Defence, because for their army personnel. So some of the physios were actively serving, and some of them were civilian physios working on military bases, whether it's Army, Navy, or Air Force. And it was a real step forward, and it was interesting hearing their stories, because I think it was recognition that the Army have personnel who are female, and they have health needs that aren't being met, especially postnatally, post-gynae surgery, probably perimenopausally, because that's another area that people don't acknowledge. So it was really, really interesting, and a very receptive, very bright bunch of physios who hadn't had a lot of pelvic health experience, but were getting more and more. And it's like everything. Once they started to open the doors to these issues, and this was female, and I said to them, when you start to see male pelvic health problems, so pelvic pain, bowel dysfunction, so on, then you're going to be so surprised at how many people suffer but don't talk about it. And I've also been asked to go give a talk to the Lancashire Police, who are doing a big women's health initiative for their female and male staff to promote and educate their female officers on what their pelvic health should be. Because way back I had a patient who was a police officer who'd had a prolapse postnatally, a rectocele, and it was quite a severe one, and her bowel function was very badly affected, and she had urinary problems. But she was a high-level athlete. She really wanted to get back to her job and be on the beat and be, bundling people into the back of her van, and she'd just been put on a desk since her surgery, and there was no effort to sort of ask about her rehab, ask about what her health needs might be, even so much as she told me that, the riot gear that the police wear is the same for the men as the women. So if you need to go to the loo in a hurry, there's no easy access, whereas, just small little sort of things like that can make, little adjustments can make such a huge difference. So I consider that a step in the right direction as well. Definitely. The fact that, big institutions, organizations like the police and the military are starting to engage and promote and train their staff in pelvic health. So that's a big coup. Have you done anything like that?
Well, not really in Portugal. I mean, I've been having experience in, kind of promoting
Obviously,
global
yeah.
health in other settings, like in humanitarian settings, where it's clearly not considered a priority. But well, there's no such thing as pelvic health not being a priority. It's in the basis
No.
of our needs, and so at the physiological needs, let's say. So it's definitely a priority. Kate, you are a Londoner. You've been based in Liverpool since many years, so you kind of know a little bit of the UK population, because in London, I mean, it's kind of this hub of cultures, and a lot of the people of the UK anyway ends up going there, spending there some part of their lives. So I think you kind of know a little bit of the population of your country by contacting with people a lot. That's what we do in our profession. So what do you think, which are your thoughts about why do people take so long to seek for help when they actually have clear symptoms of a pelvic health dysfunction?
Well, I think it's communication, Elizabeth. It boils down every time to communication. And I think there are so many layers that people have to get through before they reach the right person. Whereas if they had a better understanding of what we do as physios, they would get to us more directly. I think that takes time, and then people get fed up. They lose energy. They just think, well, I'll just put up with it because I've been to X number of specialists and I'm still no nearer resolution of my symptoms. I also think it goes back to what we said at the beginning, in that people don't recognize pelvic floor dysfunction as being abnormal. And that's why when we're saying it's common, but it's also abnormal. It's not normal, and we mustn't put up with it. And yes, we have to modify the way we are as we get older. We have to adapt, we have to change, we have to compromise, but you don't have to put up with some of the symptoms that people think they have to put up with. It's also pressure. I think, again, looking at the military, looking at the police, look at the workplace. I had a woman in today with vulvodynia, and she's had to give up her job. And I said, why? And she said, because she started working in a school. And I said, so talk me through the difference between a school and where you were. And she said, it was a male environment, and there was no way I could say to them, it's too uncomfortable to sit at a desk all day. And I said, isn't that extraordinary? Because you would feel comfortable saying it to a woman, perhaps not all women, because I don't think all women are as perhaps as easy to talk to as some. But she said no. She said that's the reality. I had to leave the job. And then she went through a layer upon layer of health professional who helped her to a degree, and then finally she came to us, and we're sort of giving her that physical, practical help, how to manage her symptoms, giving her the tools to take with her to allow her to live and work and function as she wants to, and get control back. So I think there's environmental factors. I think there are factors within you as a person, yourself. There's so much psychology with so many of our patients. The pelvic pain population, the ones who suffer pain associated with sexual activity, that can often be multi-layered, and going to seek help for that means facing up to other deep-rooted issues that you maybe didn't want to face. And that's where the multidisciplinary team comes in, because we as physios can't be experts in everything. So we might need some psychosexual help, and you've seen it. I'm sure you have the same in Portugal. I think it's, or dietitian, or personal trainers. There's somewhere for us all to be part of this package. And I think as a physio, we're very well placed to be the hub and to sort of coordinate the different specialists. But where I think we fall down is if we try and be experts in everything, because we can't be. But having said that, I do think that we have a big overlap with many. So we are really well placed to provide quite a good package. So yes, it's a really complex, multifactorial picture that prevents people from getting help. Look at social media as well. That can be incredibly helpful. It can also be incredibly unhelpful. When you think about the side of it with the pressure to look the right way, and so women perhaps ignoring things, or having little procedures and things that might they think help them aesthetically, that can end up creating, problems functionally.
Mhm.
And I'm thinking of the labia plasties, the vulval problems, the abdominal wall problems, all driven by pressure to look the right way and to exercise the right way and to be the right person.
Mhm.
But then, we're quite new in the women's, in that we have a social media platform that's from an NHS base. And why I started that, because
Mhm.
I wanted to show everyone that you could promote health education from an NHS platform, which has traditionally been seen as quite staid and conservative and not very innovative. So I think social media can be a help and a hindrance, because it's another channel that people can communicate and message you. But it's also, does it help people get access? Yeah, I think it does. And my own website, people come to me all the time and say, why has it taken me so long to find you? Why did nobody tell me that people like you, pelvic physios, exist? How do you get over that in Portugal? Is it a similar scenario?
So people can definitely self-refer to a private practice physio. So ideally, they will bring a medical, let's say, indication for physio. If they don't, we will certainly have to send that patient to be seen by a physician eventually, if we need some exams, or if we need an appropriate gynecological or urological examination. But when we talk about the national health system, then we have several boundaries. So patients usually are referred to the hospitals via the GP, so the medical, the family doctor, and then from
so
the
similar
GP,
setup.
yeah, has to be sent to the specialty, gynecology, urology, gastroenterology, and then from there to the physiatrist. So that it's a medical specialization that is kind of managing the physiotherapy departments, and then from there to the physio. So it's literally multi-layer circuit, let's
Process.
say, pathway, yeah, and it takes time.
So take yourself back a step and tell me how they know to find you in private practice. How do they know to go to the GP and get help? Do you feel that it's because in Portugal people have a better idea about what pelvic health is? They know that leaking is not normal. They don't have to put up with it.
Well,
for example.
Some people know, some people for sure don't know. We have, I think it's very universal what is happening in the UK, and in Portugal is not different. We don't have numbers, so I don't really know what is the percentage of people that would consider normal to leak urine, and the percentage of people that would say no, definitely it's not normal. So I would definitely talk to my GP about it. But by experience, of dealing with patients, with people for many years now, the surprise that people still share with us when they come to meet us, pelvic health physios with their very own pelvic health situations, is like, I didn't even know that physiotherapy had this, this specialization. And so I heard that in Liverpool, I hear that here in Portugal, I heard that in the many places well, not many places in the world, some of the places in the world that I've been working at. So I really feel that it's an issue. We don't talk about it enough. And the fact that we are part of a chain that should not be a chain. So we should be working as a teamwork, and not as the bottom of or the last element of that chain. So that people don't.
And it's global, isn't it? Exactly what you're saying. It's international, and you've seen that firsthand.
Yeah.
I feel like one of the things that we could be doing is getting into schools and promoting it at a much younger age. Certainly, I think that would help it be less of an alien topic. And the other thing we're doing in Liverpool that you would enjoy is we've got a new person in HR who's really keen to get out to the different communities and talk about what we do. So we're going to the Pakistani Cultural Centre. We're going to, I can't remember where we're going in a couple of weeks, but to give talks and to put pop-up stands and, you know, just try and, as he said, he doesn't want us to be in an ivory tower. And I think in somewhere like the women's, which is a specialist women's and babies hospital, people think you only go there if you're ill or if you really need medical attention. They think, you know, they don't want to bother you with something as minor as a bit of a bulge or being unable to open your bowels, or, you know, all these things that people just don't talk about. And especially in some of the different cultural groups and backgrounds, you know, I've had amazing patients say to me, you've opened my eyes to how I'm going to be with my own daughters. And I will be communicating about these things, because no one has ever said this. I tell you more than I have ever told my mother, you know, my partner, my sister, my brother. And you've heard that a lot, because, you know, you're an amazing communicator and people open up to you. And it's just fascinating. You just open up a complete, it's almost like they switch on their emotions, because they're allowed to, because of the questions we're asking and the areas that we're trying to help.
Exactly. Well, you know, what you mentioned that you're doing in the community, it's literally globalizing pelvic health. You're literally bringing the subject directly to people, and hopefully before they experience a problem. So just, you know, and helping them to keep improving their pelvic health before they actually experience a dysfunction.
Before it becomes a dysfunction.
Yeah, exactly.
Yeah.
So would you like to share any kind of, well, advice probably, or a last message to people that, you know, that either people from the medical field, but literally to the overall population? How would you encourage people to look at their pelvic health or to seek help if they feel that they have something going on there?
Do you mean, so really thinking about people as in patients, looking at our pelvic health?
Yes.
Well, I think you've got to understand what is normal for you first. And once you know what's normal for you, and everyone's normal is different, as we know, everyone's interpretation of normal is different. Again, we're going right back to standardization. It's impossible. Then you can recognize when things start to develop. And it's about acknowledging it earlier rather than later, and not just leaving it and thinking it might go away. Because, you know, as in this talk I'm going to do for the British Menopause Society, they wanted me to do a talk about the role of the physiotherapist. And so I changed the title and said, I want to call it Pelvic Health Physiotherapist. And then I said, does it have to be specifically related to menopause? And they said, well, sort of. So then I did my talk, my presentation, and I actually thought every single thing we treat as pelvic health physios is related to menopause, in the fact that menopause will exacerbate it. If it's never been a problem before, there is absolutely no doubt it will be amplified or triggered or accelerated or unmasked with the menopause to varying degrees. So I think it's about knowing your normal, knowing when you deviate from your normal. It's a bit like bowels, you know, people say, oh, my bowels are normal. You know, this is my go-to phrase, what's your normal?
Yes.
And it's going to be different for everyone. And then being able to talk about it and go and get help from the right person. But that's the challenge, knowing the right person. But I think communication is such an issue. And I think it's feeling that it's not a taboo and it's just a part of your body. But it is actually the hub of so many different functions that we rely on a daily basis. So your pelvis will affect your mood will affect your pelvis, your bladder, your bowel, your gut, your breathing, your moving. Really, there's nothing that it doesn't impact on. So I think it's about understanding where it sits within us as human beings, physiologically, anatomically, but also where it sits with us psychologically and emotionally. And that's no easy task for some people who have been brought up really not to acknowledge that kind of that aspect of their health, because it is acknowledging a lot of things, isn't it?
Yes, and it's being very present with yourself.
Who you are.
Yeah, with who you are. Exactly.
Very present. And there can be so many different pressures that will inhibit you allowing yourself to be in that position. And I think as physios, we're very well placed to recognize that in people and encourage them to come out of themselves and be in the present and realize what they can do to help themselves. And I always say to people, I can't do this for you. I can show you the way and I can give you the tools to do it, but you've got to understand where it's coming from and what you can do to influence it. And you know yourself, Elizabeth, most of them go out and say, I actually feel better for the fact that I've talked about it, you've explained it, I understand the plan, there is a plan. So if you don't want to get that far, to stop yourself getting that far, I think you've got to talk about it a lot earlier. You've got to recognize it a lot earlier, and you've got to go and understand where to get the help.
Yes, yeah, I totally agree with you. Kate, this has been a super conversation. We could stay here hours and hours.
I could literally stay here.
So
well,
again,
it's just been a pleasure. I miss you so much. We
I
need you in Liverpool. So everyone needs an Elizabeth in their life. Or just to plug, you know, for people to tune into our Liverpool Women's Instagram for the lives we do and the posts we put out. And if anyone wants to contact me with any questions, my Kate Walsh Physio one, always happy to take any questions. And we do get them from all over the world now, which is incredible. We've had Japan, New Zealand.
Yes.
And I'm hoping to come over to Porto soon.
You will come.
Next year. Yay!
Yes. So looking forward.
All right. Well, well done to you for everything you do to fly the banner and promote pelvic health. I just feel I've scratched the surface, but I've really enjoyed it talking to you.
Yes. Well, but you know, we need to start from somewhere, and talking about what seems obvious, that is not obvious at all. That is literally what is pelvic health for people, and even us, because we work in pelvic health. So often it's easy for us to believe that people really know what it is, because for us it's already kind of normal. And
to assume.
We assume, exactly. And so putting ourselves in that position of talking about things that we assume to be normal or natural, it's a very good exercise. So thank you very much.
I agree. And if I could just add one thing, you just touched on it there. I always say to people I'm working with or teaching or whatever, never assume that your patients have any knowledge that you know, anything like the knowledge that you have, because I think for us, we assume, oh, that's so basic, you know, breathing, it's so basic. Small changes that we think are basic can be transformational. And that's the other thing I think to take home, is that we could promote these small adjustments, life adjustments, without even seeing people, that if they implement in their lives, can make huge changes.
Exactly.
But we feel that we always have to leap to the more complicated solutions to what are sometimes very simple problems.
Yeah, exactly. And always start with the basics, because they usually never fail.
Ground up, build it up.
Exactly. And it's true that it took us years of practice as physios and of personal development as well, as people, as person, you know, as a person, to actually understand better what we actually do professionally. So
it's been quite the journey, and I think we're only on the threshold, and that's why I think it's just extremely exciting, and I feel really lucky to be part of it.
Me too. So thank you very much. We already tried to finish the conversation 3 times. Let's do it now. Thank you very much.
You know me, I don't change.
Big hug, Kate. Thank you so much.
And you, take care.
Bye-bye.
Bye-bye.